Everyone, today's topic is water soluble vitamin B complex and C. I will discuss this topic in details. Vitamin part 1 and part 2 also shared in this channel. If you have not seen, please go to my channel and watch those video first. If this video is helpful to you, please like, comment and subscribe my channel and also share it with your friends. First of all, what is vitamin? Vitamin are tasteless organic compound required in diet in small amount to perform specific biological function for normal maintenance of health and growth. So all of the vitamins are a organic compound that is a tasteless and it is required in our diet in small amount and it performs specific biological function for our growth, our health and also our immune system. And it also help proper cell functioning, but it do not provide energy themselves. Then the classification of vitamin. Vitamin can be classified into two parts: fat soluble vitamin, which is soluble in fat, and water soluble vitamin, which is soluble in water. Fat soluble vitamin are of four types: vitamin A, D, E and K. Water soluble vitamin are vitamin B complex and C. Then some history of vitamin. Vitamin is a Greek word where vita means vital for life. The term vitamin was coined by scientist Kashmir Funk. In 1912, when he trying to isolate fat-soluble vitamin B, he discovered a substance containing nitrogen, which was chemically an amine group and was in therefore named vitamin, where vita means life and amine, which is the nitrogenous compound. Then these are the some properties of water soluble vitamin. First of all, vitamin B complex and C are the water soluble vitamin. They are soluble in water but insoluble in fat. So these vitamin are called water soluble vitamin. They do not create any toxicity. They easily absorbed by small intestine and excreted through the urine. They also act as a coenzyme for the metabolism of carbohydrate, protein and fat. And as they are water soluble vitamin, they are not stored in the body except for vitamin B12, which is stored in our liver. In water soluble vitamin, first I discuss vitamin C. The chemical name of vitamin C is ascorbic acid and it was discovered by Albert Sergeant Gorgie in 1928. He found vitamin C in cabbage, adrenal gland and orange. The sources of vitamin C are citrus fruit like lemon, orange and tomatoes, cabbage, guava, melon, strawberry, and in the plants it is found abundantly, but in animal it is found in less amount. The daily requirements of vitamin C are: in the children it is 40 mg, in adult it is 45 mg, in case of pregnant and lactating women it is 60 to 80 mg per day. Then there is some biological function of vitamin C. 1. Vitamin C helps in the formation of collagen. It is mostly required for skin and blood vessel. It also acts as an antioxidant because it protects cells and tissues of human body from oxidative stress. Enhance iron absorption of hemoglobin on red blood cell by keeping it in ferrous state. It also inhibits the formation of nitrosamines, which is a powerful carcinogen. Carcinogen is a substance that can cause cancer or it can increase the chances of cancer. Vitamin C also helps in immune system by increased phagocytic action and it also requires for bone formation. Deficiency of vitamin C. As vitamin C helps in collagen formation, so in case of its deficiency, defective collagen synthesis occurs. And the main deficiency disease of vitamin C is scurvy, and some symptoms of it are like swollen gums, hemorrhage, loose teeth, anemia, and swollen joints. Those all are occurs in scurvy. Other symptoms are like corkscrew, woody legs, gingivitis. Corkscrew is a teeny small bleeding point around orifice of a hair follicle. So when a small bleeding point present around the hair follicles, especially in the legs, is called corkscrew. Then the woody legs, inflammation and fibrosis of the skin on the lower legs. As the skin of the lower legs become hard, so it's called woody legs. Woody means the hardness. Gingivitis. Gingivitis is swollen and bleeding gums. And the last point is poor wound sealing. Later, the diagnosis. Physical examination, vitamin C test, X-ray of bones in children are included in diagnosis of vitamin C. Last point is treatment. In the vitamin C deficiency, patient must need vitamin C supplement. Increase the consumption of fresh fruit and vegetable. And in vitamin C deficiency, like scurvy, was treated with ascorbic acid 100 to 300 mg daily until the symptoms remit. Clinical improvement may be noted within the first 1 to 2 weeks. After take oral dose for the vitamin C. The second water soluble vitamin is vitamin B complex, which was discovered by Casimir Funk in 1912. The component of vitamin B complexes are: vitamin B1 is also called thiamine, vitamin B2 is known as riboflavin, vitamin C is niacin, vitamin B5 or pantothenic acid, vitamin B6 or pyridoxine, vitamin B7 or biotin, vitamin B9 or folic acid, and last, vitamin B12 or cobalamin. Those all are chemical name of vitamin B1, B2 up to B12. First vitamin B complex vitamin are vitamin B1. Its chemical name is thiamine, and the sources of vitamin B1 are oil seeds, nuts, yeast, liver, kidney, milk. The daily requirements of vitamin B1 are, in case of children, 0.7 to 1.2 mg per day; in adult women and men, 1 to 1.5 mg per day; in case of pregnant women, 1.3 to 1.5 mg per day. Biological function of vitamin B1. Thiamine pyrophosphate is involved with the energy releasing reaction of carbohydrate metabolism. Thiamine pyrophosphate transfer pyruvate into the Krebs cycle. It also regulates the function of central nervous system, hearts, and also brain, and also helps to increase kidney function. Deficiency disease of vitamin B1. The main deficiency disease of vitamin B1 is beriberi. A lots of symptoms occurs in beriberi. It also affects our heart, muscles, and in case of infants also. Symptoms include in beriberi like loss of appetite, weakness, constipation, and mental depression. Loss of appetite is also called anoxia. There are three types of beriberi: wet beriberi, dry beriberi, and infantile beriberi. Wet beriberi is related to our heart muscle. Its symptoms include like edema and weak heart muscle. Dry beriberi are characterized by peripheral nerves. The symptoms include are degenerative changes of peripheral nerves and weakness of muscle. Last one is infantile beriberi. It usually occurs on infants whose age are between 2 to 4 months. Other negative impact on central nervous system, blurry vision. When it affect on the optic nerve in eyes, blurry vision occurs. Diagnosis for vitamin B1. The diagnosis for vitamin B1 deficiency include physical examination, but there is no urine or direct blood test for the thiamine levels. There is also check the activity of the transcriptase enzyme. Transcriptase enzyme needs for the thiamine activity. So if the transcriptase enzyme's levels is low, it indicates the lack of the thiamine level. Treatment for vitamin B1. In the vitamin B1 deficiency, patient must need to intake vitamin B1 supplement, and in the treatment 200 mg intravenous or oral thiamine 3 times daily until symptoms resolve. The second vitamin of vitamin B complex is vitamin B2. The chemical name of vitamin B2 is riboflavin, and the sources of vitamin B2 is milk and milk products, meats, eggs, liver, kidney, fruits, vegetable, and fish. The daily requirements of vitamin B2 is, in case of the children, it is 0.6 to 1.2 mg per day; in adult 1.2 to 1.7 mg per day; in case of pregnant women 1.4 to 1.6 mg per day. Then the next point is active coenzyme of riboflavin. There are some coenzyme for the riboflavin which is formed in the intestine and liver. Two active coenzyme of riboflavin are FMN, its full form is flavin mononucleotide, and FAD, its full form is flavin adenine dinucleotide. Later, the biological function of riboflavin. The coenzyme FMN and FAD of the riboflavin takes part in the cellular oxidation reduction reaction, and it also involves in the carbohydrate, lipid and protein metabolism, and it is essential for the eye function. The deficiency disease of vitamin B2 are ariboflavinosis, where inflammation occurs in the corner of the mouth. It's also called angular stomatitis. Then the glossitis, where swollen and painful tongue occurs. Then the next point is dermatitis. Inflammation occurs on the facial skin. The last point is stylosis, where our lips become swollen. The diagnosis of vitamin B2 include therapeutic trial and urinary excretion of riboflavin. Then the last point is the treatment of vitamin B2. Patient must need to take the supplement for riboflavin, and in the treatment 5 to 10 mg riboflavin oral once a day until recovery. The third vitamin of vitamin B complex is vitamin B3. Its chemical name is niacin, and the sources of vitamin B3 are liver, yeast, whole grains, beans, peanuts, milk and meat. The daily requirements of vitamin B3 are, in case of children, 0.8 to 1.2 milligram per day. In case of adult, 1.1 to 1.7 milligram per day, and in case of pregnant women, 1.4 to 1.7 milligram per day. Active coenzyme forms of niacin. The coenzyme forms of niacin are formed in the liver. There is two types of coenzyme formed in niacin, NAD and NADP. The full form of NAD is nicotinamide adenine dinucleotide, and NADP are nicotinamide adenine dinucleotide phosphate. The function of vitamin B3. The coenzyme of niacin like NAD and NADP are involved in the oxidation reduction reaction in carbohydrate, protein and lipid metabolism. It also acts as an anti-plague factor. It keeps our nervous system, digestive system and skin healthy. Deficiency disease of niacin. The main deficiency disease of niacin is pellagra, where our skin become rough. It is characterized by 3Ds, means dermatitis, diarrhea and dementia. In the dermatitis, dark pigment occurs on the skin. In diarrhea, blood and mucus present in the stool. And in the dementia, it affects on central nervous system and poor memory. Other symptoms include angular stomatitis, where inflammation occurs at the corner of the mouth, and it also damages our GI tract. Diagnosis of niacin. There is no specific test for the diagnosis of niacin, but physical examination occurs by the doctor. Treatment for niacin deficiency. In the niacin deficiency, patient must to intake niacin supplement where present 20 mg of niacin. Vitamin B5. The chemical name of vitamin B5 is pantothenic acid, and the sources of vitamin B5 is eggs, chicken, milk, tomatoes, whole grains and fruits. The daily requirements of vitamin B5, in case of children it is 0.8 to 1.2 milligram per day, in adult 1.1 to 1.8 milligram per day, in case of pregnant women 1.4 to 1.7 milligram per day is required. Function of vitamin B5. Vitamin B5 helps in the synthesis of coenzyme A, and it also essential for the carbohydrate, protein and fat metabolism, and it helps in the synthesis of hormones. In the deficiency of vitamin B5, burning feet syndrome occurs, where symptoms include pain and numbness toes, sleeplessness and fatigue. In the treatment of vitamin B5, patient must need to intake vitamin B5 supplements. There is no specific oral treatment. Vitamin B6. The chemical name of vitamin B6 are pyridoxine, and the sources of vitamin B6 are egg yolk, fish, milk, meat, oat, corn, cabbage and root. The daily requirements of vitamin B6 are included in case of children 0.6 to 1.2 mg per day, in case of adult 1.6 to 2 mg per day, and in case of pregnant women 2.5 mg per day is required. Function of vitamin B6. Pyridoxal phosphate, which is an active coenzyme form of vitamin 6, is essential for the metabolism of amino acid, and it also helps in the hemoglobin production. Deficiency disease of vitamin B6. The deficiency disease of vitamin B6 are include hyperchromic microcytic anemia, demyelination of neurons, peripheral neuropathy, nervousness, confusion, and depression. The diagnosis of vitamin B6. The diagnosis of vitamin B6 include patient history, physical examination, check the response to vitamin B6 supplement, but there is no blood test can directly confirm vitamin B6 deficiency. Treatment include patient must need to intake vitamin B6 supplement. The another important vitamin B complexes is vitamin B7. The chemical name of vitamin B7 is biotin, and the sources of vitamin B7 are egg yolk, milk, chicken, tomatoes, grains. The daily requirement of vitamin B7 in case of adult 100 to 300 mg per day. It is abundantly synthesized by the intestinal bacteria. So it is an important point, please note down it, that vitamin B7 is abundantly synthesized by the intestinal bacteria. Biological function of vitamin B7. Vitamin B7 is also known as anti-egg white injury factor. It's called anti-egg white injury factor because it is interact with the avidin. It is a protein which is found in raw eggs white. Avidin is bind with the biotin strongly, and it helps to prevent its absorption in the body and leading to the biotin deficiency. When the raw egg whites is present in our body and consumed in our body in large amount. Others biological function of vitamin B7 are it also act as a carrier of carbon dioxide in the carboxylation reaction, and it also essential for the energy metabolism. Then the deficiency. The deficiency of vitamin B7 is rare because it is supplied by intestinal bacteria. But there is some problems also occurs in the deficiency of vitamin B7 like loss of appetite, nausea, dermatitis, glossitis, anemia, and neurological disorders. The diagnosis of the vitamin B7 is included in the blood test, and the treatment is included. Patient must need to intake a lot of biotin supplement. Most important vitamin in the vitamin B complex is vitamin B9. The chemical name of vitamin B9 is folic acid, and the sources of vitamin B9 are green leafy vegetables, whole grains, meats, and eggs. The daily requirements of vitamin B9 is in case of children it is 100 to 300 microgram per day, in case of adult 400 microgram per day, and in case of pregnant women 800 microgram per day. Biological function of vitamin B9 or folic acid. Biological function of vitamin B9 or folic acid. It helps the synthesis of amino acid and purines. Tetrahydrofolate, which is a coenzyme of folic acid, helps in carbon metabolism. It also repairs of the nucleic acid, red blood cell formation in the bone marrow. It helps to the development of the fetus and neurotransmitter formation. Deficiency of vitamin B9 or folic acid. In the deficiency of vitamin B9, megaloblastic anemia occurs, where macrocytic RBC are found. Means the size of RBC become larger than normal. 2. Decrease the production of purine and DTMP, which impairs the DNA synthesis. So it affects on also DNA synthesis. Third, it affects on the neural tube. So neural tube defects occurs. Diagnosis of vitamin B9. In the diagnosis of vitamin B9, folate blood test is done in the biochemistry lab. Then treatment. In the treatment, patient must need to take vitamin B9 supplement and oral doses. The last and most common vitamin of vitamin B complex is vitamin B12. The chemical name of vitamin B12 is cyanocobalamin, and the sources of vitamin B12 are meat, shellfish, milk, cheese, eggs, fish eggs, crab, and it is rare in the plants. The daily requirements of vitamin B12 is, in case of children, 1 to 2 microgram per day, in adult 3 microgram per day, and in pregnant women 4 microgram per day. Then the biological function of vitamin B12. Vitamin B12 is essential for the production of RBCs. It also improves the concentration, memory and the balance of the body. It also importance for growth and helps in the carbohydrate, protein and fat metabolism. The deficiency disease of vitamin B12. The most common deficiency disease of vitamin B12 is megaloblastic anemia or pernicious anemia. It can causes the degradation of myelin sheath and peripheral nerves. Third, low hemoglobin level. Fourth, nerve cell death. The diagnosis of vitamin B12. Vitamin B12 blood test in the biochemistry lab or complete blood count or CBC test in the hematology lab. In anemia, the RBC shape become changes, so it can detect by the complete blood count. Then the treatment of vitamin B12. The treatment of vitamin B12 include patient must need to take vitamin B12 supplement, oral medication and intramuscular injection. So thank you everyone. Our topic vitamin is completed now fully with notes and discussion. If today's session is helpful to you, please like, comment and subscribe my channel. Also share it with your friends, and if any doubt, please comment it.